A third Ebola patient may be headed to the special biocontainment unit at the Nebraska Medical Center this weekend, the hospital confirmed. A third Ebola patient could be headed to the special biocontainment unit at the Nebraska Medical Center in Omaha on Saturday, the hospital confirmed. The Associated Press identified the patient as Martin Salia, a surgeon who was infected with the virus while treating victims in Sierra Leone, one of the hardest-hit areas of West Africa. The patient is a Sierra Leonean national who is a permanent resident of the United States and lives in Maryland, AP reported, citing an anonymous source. He reportedly was working at Kissy United Methodist Hospital in Freetown, Sierra Leone, when he came down with Ebola symptoms on November 6. He tested negative for the virus at that time, AP reported. When he was tested again on Monday, the results came back positive. Doctors are evaluating the patient's medical condition to see if he is healthy enough to fly to the USA for care, said Taylor Wilson, a spokesman for Nebraska Medicine. A specialized medical transport plane, run by Phoenix Air, could fly him to Omaha if he is strong enough. The condition of the patient will dictate whether he comes to Omaha for treatment, Wilson said in a statement. He will be evaluated by the medical crew on the Phoenix Air jet upon their arrival in Sierra Leone. If the patient is strong enough to fly, he would arrive in Omaha Saturday, Wilson said. For now, the patient is in stable condition at an Ebola treatment center in Freetown, AP reported. Nebraska's biocontainment unit has already successfully treated and released 2 others, physician Rick Sakra, a missionary delivering babies in Liberia, and Ashoka Mukpo, an NBC News freelance cameraman who also became infected while working in Liberia. All 8 Americans treated with Ebola in the USA have survived. A Liberian national treated in Dallas, Thomas Eric Duncan, died of his illness. Among the special features of the 10-bed Nebraska unit are air handling, filtration and ultraviolet systems to keep microorganisms from spreading beyond a patient's room. Staff also receive careful training and practice in protocols designed to keep from being infected with Ebola. On Thursday, Ron Klain, the White House Ebola response coordinator, said the country would see other cases of Ebola in the United States, as the president has said, occasionally and sporadically. He hailed the successful treatment of a New York doctor infected while treating Ebola patients in Guinea. It's a milestone because it shows that our healthcare system can successfully identify, isolate and treat an Ebola patient, and return him home and healthy, he told representatives of non-profit and faith-based groups meeting at the White House. We are not at the beginning of the end or even the end of the beginning, but we are at the throes of this effort in West Africa with interventions that can work, he added.